tonight's topic is the cementation of the veneer, ceramic veneer, and I prepare for you a clinical lecture. So I want to get you some information and some trick and track to improve your work in your surgery. Only with composite is possible to have less gap in the margin, because you can have the best precision on the margin, but with ceramic is not possible. And I told this because if we have this thickness of cement on the margin, we need to use a very strong, a very stable composite to bond our laminates. And if we use the normal flowable cement, you have bubbles. We did a lot of tests, and you see that this cement, this flowable cement, they are full of bubbles, and the bubbles create problems because bubbles contain oxygen, and oxygen inhibit the polymerization. And from the bubble starts the internal microcrack, and this reduces the strength and the resistance of the bonding phase. While, look, bubbles also here. These are laminates bonded with a normal flowable cement. While if you use an high-filled flowable cement, you don't have these bubbles. This situation is much better than that one. So we develop an high-filled flowable material. But the material is not only high-filled, but the fluidity, the flowability of the material has to be adequate for cementing the veneering. Because the problem is that when we bond the veneering with the normal flowable cement, we have cement in the interproximal spaces, we have cement all around. And I don't like this, because you spend a lot of time to remove, to clean very well, and to have the right situation, the good situation. And from the bubbles start the microcracks. Look. So we developed this new cement. This is NSM high viscosity, and it's also high fill. We have an high viscosity, 600 psi, high fill material, 80% in weight. It's BSDM-free, maximum of biocompatibility, and we have fluorescent and radiopacity in the best way. The physical characteristics of this cement you see here, and we have a very good result both from the Vickers hardness and the Young modulus is very, very good. The flexural strength through 154, and the compressive strength, it's incredible, 4,110. I think that these physical characteristics are incredible for a cement. It's important also the ratio between the thickness of the ceramic and the thickness of the cement. And the facial ratio below 3 is not good. We have to stay up of 3. For example, 4, where we have this relationship between the thickness of the cement and the thickness of the laminate. And we know that experimental numeric trials have demonstrated that the crack propensity of porcelain could be related to the respective thickness of lutic composite and ceramics. Most cracked porcelain veneers exhibit a facial ratio below 3.0, while most uncracked specimens had a facet ratio greater than this value. So it's important to have this relationship between the thickness of the ceramic veneering and the thickness of the cement. And now I want to show you the step-by-step we need when we do a cementation. I show you this case. This is a lady, and she doesn't like the shape of her tilt. So I did a WhatsApp. I did also a mock-up, and then we decided for the shape and for the new contouring of this tilt. These are the preparation I did, and the first problem is how to fix the temporaries. This is, I spend a lot of time with the temporarization because the temporarization gets a lot of information to the patient because he has the time to look at the mirror, the new contouring, the new shape, the new smile, and also can get a lot of information to the technician. And it's important to have a good stability of the temporaries in the mouth. How we have to do to cement these temporaries, because then we need to remove these without to break the temporaries and without to break the teeth. So I use this spot etching technique, and now I will show you how to do in a movie. So this is the case. This 1 week after the cementation of the temporaries, and you see the preparation before to cement the laminates. And in this phase, you can do a try-in using a try-in gel. Try-in gel allows you to check the final color, because try-in gel, it has the same chromaticity of the cement, but it doesn't cure. So it allows you to have the time to check, to control, change the different chromaticity, and at least it can get you some information about the cement you have to use. So after this, you can cement, and I always cement using the rubber dam, and I use to cement one by one, and this is the final result. There was this problem on the gingival tissue, this retraction. So after the cementation of the veneering, the patient, she was very happy. So I convinced her to have a surgery, and you see after the surgery, and before and after the treatment. And now I show you this video that show how I fix the temporaries. Provisional cementation for veneers. You have to clean very well the temporaries. Use alcohol for this. You have to dry very well, and then I apply an adhesive system, Elabor, where we have primer and bonding together. It's a one-bottle system. Is allowed to have a good bonding with the temporaries. You have to blow air in order to eliminate the solvent. And then I put the same also in the other one. I have two temporaries. You have to cure 40 seconds. And now the temporaries are ready. we put some aerosol. This is a flowable material. It's very elastic and it works perfectly. While in the mouth, we have to etch like a sport, 20 seconds. After this, we have to move a little bit the gel, and then we have to remove the gel. Rinse very well with water, eliminate the water with dry air, and then I apply Enabond. Enabond is different than resin. Enabond is only resin, so you don't have a straight bonding. You only have to cut the preparation with resin, and then you put the two provisionals where there is enough flow. Enough flow creates a seal on the mouth. Now we have to remove the excess. And then check very well the position. You have to eliminate the material in the proximal areas. This material is able to create a gasket on the margin and seal perfectly the preparation. You have to cure 40 seconds each tooth, buccal and palatal. Then with the curette, it is a greasy one too. You can remove some excess. You can remove the bonding. But the material doesn't on the margins. And now we have a good temporalization, a good seal on the margin, but we can move in a very easy way without have any problem to temporize. And we see just bond it, okay? One week later, when the ceramic veneering are ready, so we can remove the temporary using this instrument. With the hammer, it's very easy to remove, and you see that all is clean. There is no problem. There is not infiltration. There is no micro leakage. We remove the other one. Looks fantastic. Look how is the internal area. No infiltration, no micro leakage. Now we have to clean very well before to do the try-in. This is the try-in gel, and now I do the try-in of the ceramic veneer. These are the ceramic. This is feldspathic ceramic. I'm using a chromaticity. At least you have to say to me, prefer my music or my dentist. Yeah? This is, I did this music. The composition also I played with my piano. Now I blow with air in order to remove the gel, the interproximal areas. And this is the try-in. What about the treatment of the ceramic? You have to clean very well the surface, the internal surface, and after the try-in, and you have to sandblast with the aluminum oxide the entire surface. After this, you have to etch the entire surface with hydrofluoric acid gel. For if you use feldspathic ceramic, you have to etch with fluoric acid for 2 minutes, but I prefer 1 minute and a half, 90 seconds, and with lithium disilicate only for 40 seconds. After this, you have to wash and rinse the SS ceramic surface under copious water, clean the restoration ultrasonically in distilled water for at least 2 minutes. These are the steps you need to have a good treatment in the ceramic. After that, you see in the microscopy before and after the treatment with hydrofluoric acid. After this phase, after the etching phase, you have to selenize and you have to use the silane. You apply 1 layer of silane. Silane is a coupling agent on the etched intaglio surface of the ceramic restoration. And you have to brush for 1 minute. After this, you have to dry with air. And then you have to repeat 3 times. If you want to have a good salinization, you have to repeat this for 3 times. 1 minute brush, you have to blow air, you have to repeat, blow air, and you have to repeat. Okay? After this, after the first step, you can dry with an air dryer, because if you use warm air, this increases the adhesion and the silane works better. After this, you have to apply 1 layer of adhesive resin and air thin with oil-free air using the syringe. And you haven't to polymerize, but we will see this in the video. You see the situation on the imaging made with microscopy before etching and after etching and silanization. So I repeat, ceramic veneer cementation, tooth, sandblasting with aluminum oxide. Yes. You have to wash very well with water in order to eliminate the aluminum oxide. Etching with the acid for 30 seconds, orthophosphoric acid for 40 seconds. Wash with water, and if you want, then with chlorhexidine in a aqueous solution. Sometimes I use, sometimes I don't use, but if I don't feel any difference, then you can use two types of adhesive. If you use a traditional one, two bottle, primer and adhesive, like Optibond. Optibond, it's considered the gold standard in this field of adhesive. So you have to apply primer, you have to blow air, and then you have to put a layer of adhesive resin. You haven't to cure. But I prefer use Enabond. Why? Not because it's from Mycerium, but because when you apply Enabond, it works like a primer, but there is the possibility to cure. So you seal very well the surface, then you apply the adhesive resin, like adhesive resin of Optibond, and you haven't to cure. But in this situation, you already seal the surfaces of the denting, of the exposed denting, and of the enamel. What we do in the ceramic, cleaning and sandblasting of the ceramic surfaces, etching 9.6% fluoridic acid for 1.5 minutes in the phase particle, etching 5% or 9.7% hydrofluoric acid for 40 minutes in lithium disilicate. Lithium disilicate needs less time of etching. Wash thoroughly with water, cleaning and distilled water with ultrasonic for 5 minutes. This is important because you clean very well the surface and you eliminate all the inclination that is after the etching phase. You have to dry very well the surface, and then you have to apply sealant for 1 minute and dry with air. Repeat 3 times, and then it dry. I use an air dryer. You can apply the adhesive resin or in the one of a traditional system, or I use a seal. After this, you have to apply inside the cement and place the veneer on the tooth. This protocol follows the protocol published in the Journal of Adhesive Dentistry some years ago. It's the same protocol. You can check this work and you find that I do the same. So I show a clinic case. I have to remove these laminates. I re-prepare, and then I prepare the temporaries. I apply the temporaries, like I told before. You have to apply Enabond inside. You have to cure Enabond, because I want that when I remove the temporary, the cement, the Enaflow, has to stay in the temporaries. So this allows you to remove completely the cement, and you don't have to spend time to clean the surfaces of the preparation. This is why I use henna bond, because I want to have a strand bonding between the resin of the temporary and the henna soft. Spot etching, henna seal is different from henna bond. It doesn't contain primer, and it doesn't work like an adhesive system. This is a complete adhesive system. This is only fluid resin. Then I put henna soft flow inside, and you have to remove the excess, to remove in the interproximal areas, and then you have to cure. You see the temporal in situ, and 1 week after, you see that the gingival tissues are perfect now. You remove with a hammer or with another instrument, and you see that there is no micro leakage inside. And these temporaries, they seal perfectly because this material allows you to do a good relining of the temporary. Now we are ready for cementing the veneerings. But before I do a test color with try-in gel. This is the try-in gel in situ. And then we can start with the cementation. For cementing, you have to sandblast the surfaces in order to remove completely the bonding we use when we apply the temporaries. Then we have to etch. I did total etch here because I was completing the enamel. Then henna bond, curing 1 minute, henna seal. You haven't to don't cure henna seal. Veneering, sandblasting, etching with fluoridic acid, signalization 3 times, okay? Then henna seal, you haven't to cure, henna chem. You see that the viscosity is perfect. You have to stratificate inside the henna chem in order to have a thin layer everywhere. And you see the laminates in situ. You have to remove the excess. And when you understand that the position is perfect, you can cure. After the removal, and 1 week after, you see the perfect integration in the gingival tissues and the perfect integration on the point of view of the aesthetic, shape, and color. Before and after, Marco Cosso did these laminates. Very, very good. You see the color, you see all these Isalo, this characterization, the intensives, very good work. And now I'll show you a movie. Cementation of ceramic and composite veneer and inlays. These are the preparation. You see that I am out of the This step allows me to understand what is the right cement I have to use. The field isolation is very, very important. And to because I don't want the cement or bonding enter inside. I am etching the laminate after the sandblasting treatment. Hydrofluoric acid 90.6%, 90 seconds. You have to rinse very well with water and put in the ultrasonic system for 5 minutes. Sandblasting of the tooth surfaces in order to completely eliminate all the bonding. Rinse very well with water. I have to synchronize the laminates. So you have to apply water with you have to blow air inside, and when it's completely dry, the surface, you have to apply snap 1 minute 3 times. And first one, the second one, always 1 minute. Blow air. And now I use an air dryer. This increases the bonding, the strength, and our slime to our better. The tooth adhesive phase start with the etching of the surfaces. 20 seconds. Rinse very well with water. You have to apply and wrap for 1 minute and then cure for 40 seconds minimum. So you have sealed very well. Now a layer of bonding resin. Blow air in order to have a thin layer, but you haven't to cure. And a seal also in the laminate. And now the cement. Cement has very, very good physical characteristics. We fit the laminate on the preparation, and then very easy to eliminate the excess. The interproximal areas are very important. You have to completely eliminate the cement in that areas. have to check if all it's okay, if the laminate is in the right position, and then you can cure. 40 seconds, 3 times per side. After that, you can remove the rubber dam, and you can remove the excess using strips, interproximal strips. This is a finishing phase. And we remove also the board. I already removed this. There is no interview. But it's better to check 2 times or more. Okay. All the sulcus is completely free. Now I have to cement the 2 incisor. I need to cement together the 2 incisor. But before we have to check if the fit is okay. All seems okay. So we can isolate the field with the rubber dam. But before I check also the interproximal contact. It seems good. So we can start also with these 2 laminates. Always the same protocol. Etching phase with hydrofluoric acid, ultrasonic treatment, sandblasting of the surfaces. Total edge, 20 seconds. Rinse very well with water. It's important to completely eliminate the gel, the etching gel. And then, enabond. It's important to rub for 1 minute. The adhesive system needs time to work well. Minimum 40 seconds. And then bonding a thin layer. You have it. And now we are ready for cementing these 2 mini rings. I remove the interproximal matrix. The first one. And the second one. to cement this, I cemented the other lateral. I start from the lateral and on the right, on the left side, then the lateral on the right side, and at least the two incisors. We have to remove the cement in the interproximal area. This is a very delicate phase, but it's very, very important. Now I remove the wedge. The positioning of the wedge doesn't allow the cement to go in the deepest part of the interproximal area. Now, with the floss, I check the position, it's okay, and then we can cure. And after the polymerization, can seal the margin with bonding, cure, 40 seconds is the last step, and then we can remove the rubber. I prefer to cut the rubber then. Now we have to remove the excess cord, and with this rubber point, I finish really well the margins. It's a rubber point. It's not abrasive on the ceramic, but it's abrasive for the bonding of the cement. So it allows you to have a very clean surface around the margins. In the interproximal area, I use tapes, and this is 1 millimeter. You see, it's very, very good, the final result. We achieve a very good color match.